Okay, I want to talk about an article that recently came across my Apple News feed about facelifts. And it's how facelifts got so much better. And then the subtitle is The Forever 35 Facelift. The facelift is better than ever, and everybody wants one. Deep inside the uncanny world of the surgically ageless. Now, first of all, let's just think about this real quick. Have facelifts gotten a lot better? I think they have. That's one of the most awesome parts of plastic surgery, that it's a field that's always evolving, always getting better. We're always educating one another. And that's what I love about it, in addition to so many other things. All right, let's go and dig a little bit deeper. All right, so I want to now kind of pick apart this article just a little bit. A few little criticisms. One is that the author uses the term general plastic surgery as to compare them to facial plastic surgeons. And it's as if there's a little bit of judgment associated with that, almost a little bit of sort of differential credentialing. And what I want to point out is that many plastic surgeons, so they've done different training than facial plastic surgeons, that many plastic surgeons have done a full 6-year focused residency that really integrates the education and focuses on plastic surgery, where they get a lot of exposure to facial plastic surgery. And then some people like me even go on to get additional fellowship training and really consider themselves facial plastic surgery specialists. Now, let's compare that in a really positive way to facial plastic surgeons. Now, facial plastic surgeons, when they use that term facial plastic surgeon, what that means is that they are ear, nose, and throat doctors who have done generally a 5-year residency that covers many aspects of surgery of the head and neck, and then go on and do a 1 or 2 year focused fellowship on cosmetic surgery of the head and neck, and also reconstructive surgery of the head and neck. And what I mean to do is to untangle a little bit of the comparison that the author makes so as to tell you guys the absolute truth. And that is that a plastic surgeon who has a lot of experience and really is considered a facial plastic surgery specialist, and someone who has done an ear, nose, and throat residency and gone on to do a fellowship in facial plastic surgery, both of those people are equally qualified to do an amazing facelift. And there are people, individuals in both fields, in all cities, who provide excellent results in the most modern forms of facelifts. So I just wanted to bring that out because I thought the article was slightly misleading in that regard, using this term general plastic surgeons. All right, now another thing that the article brings up is the whole idea of the Ozempic face. Now, we know that with significant weight loss, deflation of the face, we are seeing patients at younger and younger ages desiring facelifts, and that we are seeing patients with much more skin than they used to have at earlier ages. And facelifts are becoming very common among our population of patients who have lost a lot of weight from Ozempic and other weight loss drugs. So hooray to the author for bringing that to everybody's attention, because it is true. Then another thing I want to talk about is they get very technical, which I think is really cool. The author is trying to understand this a little bit better and talks about sort of comparing and contrasting what would be called a SMAS lift and a deep plane facelift. And one of the things that's interesting is that they interview a really experienced plastic surgeon who is a facial plastic surgery specialist, and has a little bit of a discussion about that. And what it boils down to is that what's considered a SMAS lift and what's considered a deep plane facelift is almost a academic difference. Now, there's a real difference, and I want to say that I lean more towards the deep plane facelift technique nowadays, but that doesn't mean that a SMAS lift doesn't make sense and doesn't make sense for some patients. What is the difference? The difference is the amount of skin that is lifted up before you go into the deep plane. That's really what it is. And I think that it's a conversation that really centers around what sort of vectors you're using for the deep plane, the SMAS, and for the skin. Are they the same vector? Are they slightly different? See what I'm talking about? It gets very technical, but for what it's worth, it's a very interesting conversation. It was overall a really good article. And if you can find it on your Apple News feed, which can be a little bit challenging sometimes, it's worth a read.